And if you look at the numbers of deaths right now reported since April until now, it's just under 5,000. That gives us, if it continues to grow at the rate that it's been growing, that would give us under 10,000 deaths for the year. The CDC reported in 2003 that each year it's estimated that 500,000 people would die from the seasonal flu.
So we're dealing with a very strange and creepy scenario, especially with the response globally being directed through the Pentagon. U.S. Northern Command is in charge militarily around the entire globe in terms of the public health response to this virus, which doesn't appear at this point to be highly lethal or even more virulent than the normal flu. And yet they've escalated it to a level 6, the highest level the WHO has, and the U.S. military is in charge both domestically and internationally of the response. So.
Oh, WeAreChange? Yeah, WeAreChange.
Oh no, I mean that's not.
I imagine you're trying to get the information out there.
Exactly.
Who are you guys from?
We're with the Institute. Oh, okay. Do you guys have any particular slant you are going for with the coverage? Or?
Yeah, in terms of we're trying to sort of get the public health officials to answer why there's so much odd stuff going on around how aggressive the vaccinations are being pushed, especially in the United States. Because his answer around the way the Mexican government is treating it seemed much more.
Basically, because we were facing a new pathogen, we knew we did not have immunity to this pathogen, and what we were seeing was that this pathogen was affecting young adults. So.
And yet here we have all these stories of healthcare workers being coerced. They're going to lose their jobs if they don't take the vaccinations. And of course, military is completely at the mercy of the Pentagon, and they're being forced to take in. There's some bad stories coming out from Navy vessels. So we're trying to see what the whole range of opinions are from health experts, and also including the problems of the origin of this virus, and because it is a very strange appearing virus. We've never seen a virus like this before, and there was a story earlier in this year, Baxter, the company, they were found to be shipping out cases of H1N1, I think, which is the normal flu vaccine, to about 18 countries, and in there was a live avian flu viruses. Most people who have experience in those kind of lab conditions know that that's not the type of thing that happens from pure negligence. It's possible, but many things are possible, but not likely. Same thing with the origins of this flu, And they were caught. Luckily, the shipments were caught before they were given to people in these 18 countries. But it brought up a lot of questions about either criminal negligence, because anyone who's familiar with working in a laboratory with things like vaccinations, it's very difficult to come to a scenario where a live, especially an avian flu, is mixed in with a normal flu vaccine. So those types of things, those are what we want to sort of get out in the open here and give the public health officials a chance to respond to that type of stuff. And then the other side of it is actually the response by governments in terms of this, which would include, the fact that the WHO brings it up to a level 6 pandemic, change the definition of pandemic in order to sort of do that. So that, so that's one thing. And then the other side of it is the fact that the U.S. Pentagon is basically in charge of it, both nationally but internationally.
From a U.S. agency or something?
Oh, WeAreChangeLA.
What's that?
WeAreChangeLA. He's the guy to talk to on that.
Oh.
So those are the questions we want to sort of
Sounds good. Yeah, I'm excited to see it.
Oh, good. Oh, yeah.
How are you, doctor?
Thank you for your answer. So, Can we film this?
What you use agency?
Yeah, we're a citizens media group.
Okay.
And what we're trying to do is just sort of ask a lot of questions that citizens in this country and around the world are concerned about and don't see that their mainstream news are asking in a way. This virus. You're familiar with maybe not sure
Because he's actually here.
What's that?
Because you're maybe not shoot this because we weren't expecting
Oh,
press
okay.
coverage. We didn't know you guys were coming.
Okay.
So,
People are waiting.
have dug up bodies, Inuit bodies, right, to research, recreate the 1918. So, and there's just been too many of these types of
What's that?
You're not to shoot.
slipping out of laboratories for people not to want to get to the bottom of the nebulous origins of this virus,
Well, I
especially
do-
since it's a triple recombinant. We still haven't found whether it jumped from these, because it was actually misnamed the swine flu in many ways, because we still haven't found the pig populations that probably transmitted to the human beings. So, it was not found anywhere, right? In terms of
No, I mean, they make a lot of noise for this farm, which is near this community of El Perote. But as I said, most of the samples from El Perote were seasonal influenza. Just one sample tested positive for hundreds that we analyzed. And early in the epidemic, people make the connection, but it's very likely. Because we have samples earlier on, now that we have reconstructed our historical samples, we know there were earlier cases, so this is not like the index case. And also, I think when CDC gets to their archival samples and start looking for H1N1, they are going to find positive cases because this virus has been circulating. That's why it was found in California.
And what's your perspective of how quickly it was put up by the WHO to a level 6 pandemic, and the actual definitions of pandemic changed in order for that to occur?
Well, because they didn't know exactly what we were seeing. We didn't know even what we had.
You were freaked. You were a little freaked out.
We were acting. I think on retrospectively, we acted a little bit. We overreacted. However, it's better to overreact than
Underreact. But since then, it seems it should have been modulated back down.
Okay, we're letting him talk. He's not expecting press for this, okay? You guys shot in there. We asked you not to shoot here. That's all we ask, okay? Give us a little break here, okay? If you want to talk, let him talk, but just don't record. He can't talk for himself? I'm speaking for him as part of his representative, okay? Okay, he wasn't expecting press for this, okay? So,
we know
you're here to get in your interview here, okay? You don't mind? Well, you actually just not going to
Okay, I appreciate your time.
Dr. I just had one quick question. Here in America, we're seeing mandatory vaccines in certain areas. And thanks, you guys. Thanks for coming.
Thank you.
So apparently, the health concerns and even the concerns that we had back in the 70s with the swine flu deaths, where it was reported that more people died from the swine flu, from the vaccine than the actual swine flu, didn't really seem like it was a concern for him, so he was going to support Big Pharma by supporting the vaccinations when they come to Mexico.
I told him about the Baxter story. He didn't seem that concerned by that, so that made me concerned. And then the folks who ran the event were concerned, I guess, that we were filming and that we were acting as press, having not notified them, and that he wasn't prepared for that. But they should always be prepared, because we citizens are also part of the media. The First Amendment doesn't say that you have to have press credentials to be a part of the press. The press is anyone who wants to report on public affairs, on things that they think are important in many ways. So, and we thought that getting some of these questions out there were important.
But anyway, thanks for stopping by.
All right, thank you for the event.
Thank you for
Appreciate
coming.
it.
I appreciate your time.
All right.
Thank you. Take care, Kevin.
Take care.
All right. You know, I definitely think that we had an effect with the people that were here and the people that will watch this. So overall, I think people will begin to get awakened and question vaccination. So I think it went well.
Great. Thank you, man.
Thank you.
Great.
That's it, I guess.
All right, man. Cool.